You have cancer. 3 words that change a life forever. We would like to offer another 3 words. Be an overcomer. Welcome to the 1% Podcast, where our conversations with other cancer warriors, survivors, and caregivers allows us to give you that extra boost you need to face your challenge head on, live life from a new perspective, and forge a path that keeps you moving free and clear. Now, welcome your host and cancer survivor, Truett Taylor.
Welcome to today's episode of the 1% Podcast, the show where we interview young adults who are battling or surviving an unexpected cancer diagnosis. You are not alone, and I promise, by consuming today's content, your soul will be fed with the hope, courage, and inspiration you need to keep fighting for today. I'm excited to be on your journey with you today. If you haven't done so already, be sure to head over to 1%podcast.com to sign up for our email list to see the latest news and updates for all our guests on the show. You can also check us out on Instagram, Facebook, and Twitter at 1% Podcast. If you want to join in on some of our discussions, please join our Facebook group, the 1% Podcast. To contact me directly for content, questions, or booking events, you can email me at info@1%podcast.com. This is episode 44 of the 1% Podcast. I'm so excited you're here with us today. My guest on the show is Miss Lauren Feltz. She's got a phenomenal story, and she's going to be able to give you some great instructions about melanoma. I learned so much by talking to her. But before we get into Lauren's interview, let's go over today's 1% moment of truth. Today's 1% moment of truth is about returning back to a normal or somewhat normal life after cancer. Cancer is often described as a journey that starts at diagnosis. During treatment, some people feel that their life is on hold. After treatment ends, it may be hard to know how to resume normal activities. Sort of like being in limbo. Survivors may expect life to return to what was like before cancer diagnosis, but for many people, it isn't just that simple. So the reality is it's more emotionally and physically complex than you ever thought it would have been. Some cancer survivors find that they can't or don't want to go back to how life was before. So let's talk about finding a new normal. Many survivors say that cancer changes them. I know it did for me. After treatment, I didn't feel like I even looked at things the same way. With time, we tend to find out our new way of living, and a lot of people call this the new normal. So whenever I finished my treatment, it was really hard for me to celebrate things and even just to laugh when things were funny, to feel grateful and like I feel like I didn't need as much support. So I'm going to give you guys a couple of tips and a couple of things to look for that I wish I would have known whenever I finished my treatment. One of the first things that I recommend people to do is to take a full assessment of your life. Take a personal inventory of your physical health, whether it's your physical activity or your eating lifestyle, and then also your emotional health as well too. There's 2 things that are very important when it comes down to recovering and getting back into a new normal. So for physical wise, for me, I had to adjust to what I could and couldn't do physically. I think I mentioned in several podcasts before that I couldn't even carry my own groceries up the steps. So what I did was I jotted down, okay, so today I couldn't do this. Tomorrow I'm going to try this and this and this and slightly progress up. And then same thing emotionally. I couldn't enjoy time with my friends or my family, and certain movies just weren't funny that I always laughed at. And I started jotting that down as well too. I could see little small increments as I grew. And what I found out was I got a lot better physically first before I did emotionally. So keep a journal of that as well too. And Lauren and I are going to talk about journaling inside of her interview today. But that's my second tip for everyone is, when you take your assessment of yourself, start a journal. Start journaling your progress, because like anything else, when you can see progress, you tend to be happier and it gives you something to look forward to. The third tip I have for you guys is to do things at your own pace. Avoid the pressure to make decisions or start new activities straight away. If you feel apprehensive about going out for the first time, ask someone to go with you. If it comes down to you starting a new physical program, start off with increments and be sure to plan rest time in between those activities. But don't feel rushed to get back to what you consider normal. And the final tip I have for you guys is, you need to find an outlet to be able to share your feelings or worries or any kind of concerns you have with your family or friends or a support group. One thing that for me, I wasn't a support group kind of person, but moments where you can share your moments or your feelings with other people, whether it's you guys listening to this podcast together and just talking about, different feelings that come up as you hear other people tell those stories. You need to find some sort of survivorship program that you can connect with. Again, whether it's a support group, a podcast, a local event, whatever it is, you got to find something to help you process on the way out. Because for me, I felt like once I was done with all of my treatment, then everybody thought I should be better. And then maybe all the doctors thought, well, I'm done. He can kind of figure out the rest on his own, which that is totally not the case. And it's one of the main reasons that I do this podcast is because I want people to really feel connected with other people. This is the part of the process that people don't talk about a lot. Everyone loves to talk about chemo and what to do to get rid of the cancer. But those of us that get on the other side of survivorship, we need some instruction on how to live our life and how to live the best portion of our life now that we've had this very traumatic event go on. We're not the same. We look at life completely different, and we really need some instruction. So I hope you enjoyed these tips. I'd love to hear your feedback. Just be sure to respond to one of the social media posts that we put out for the podcast. But let's get into our interview with Miss Lauren Feltz. Lauren is such a rock star, and by the time you finish hearing her interview today, you'll feel the exact same thing that I felt when I first spoke to her. She is full of knowledge, full of passion, and a tremendous patient advocate. Lauren has a journal out called My Journal Journey, and you can go to withinmyskin.com to purchase that. And she's just going to tell you all about her journaling club that she started, which I thought was a great idea. Her life as a healthcare provider. We're going to go into all those details. So you're going to love our interview today. You're going to love getting to know Lauren. So enjoy my interview with Miss Lauren Feltz.
All right, Ms. Lauren, how are you doing today? Welcome to the 1% Podcast.
Hey, Truett. How are you? Thanks for having me.
I'm good. Enjoyed speaking with you the other day. We were talking about melanoma. You're the first person I've had on the show with melanoma, so I can't wait for you to just drop all the information that you have and your experience with all of our listeners. But you're up in Massachusetts right now. I'm sorry, New Jersey?
New Hampshire. New Hampshire.
Okay. All right, somewhere up north.
Great White North. Exactly, the Great White North.
So are you a Patriots fan?
I am, but I hate to answer that because I will be just harmed on the street if I say that I'm not a Patriots fan up here. But I do hope that other teams give us a good game. We'll put it that way.
Gotcha. So being from Atlanta, obviously, a couple of years ago, there was a situation, the 28-3 situation that happened. So we don't really like to talk about the Patriots too much here in Atlanta. But, we'll get through the interview and be just fine today. So but I'm excited for you to be on our show. I think you have a tremendous amount to offer all the listeners and stuff. So why don't you start with telling everyone a little bit about who you are and what you currently do?
Yeah, well, thanks again for having me, Truett. I think it's great what you're doing with the podcast. I think it's a great resource for everybody. So as for me, my name is Lauren. I live in a little town in New Hampshire called North Conway. It's a great, cute little town. It's kind of a playground for everybody in New England. And I was diagnosed with stage 3B melanoma in March of 2015. I can't believe that it's been that long, but so I was diagnosed in March. Things happen very quickly, as do everybody who's had cancer can kind of talk about the whirlwind that cancer creates in your life. And at that time, I was doing anesthesia. So I had graduated with a master's in anesthesia, anesthesiologist assistant, and I also do something called intraoperative neuromonitoring, which is my baby now. And it was just an interesting time. It's still an interesting time. I think that anybody who has cancer, even if you're declared no evidence of disease, the experience lingers with you for your entire life. It changes your life. And it, for the better or worse, we get to rebuild the lives that we get to create ultimately. So, so thank you for having me. I'm really excited about being here.
Yeah, that's so true. Okay. just listen to what you said. I'm sure you've seen some pretty interesting cases in your life. Most people can have some great experiences, and you work mostly in the OR, I'm assuming. So what?
Yes.
Yeah. So before we dig into the story today, what would you say would be the most interesting case that you've seen so far?
Oh gosh, in the operating room, the ones that stick with you are always the hardest ones to be working with. Mm-hmm. I think that the ones that really stick out in my mind are always the hardest ones. I describe it as when you really do your job in the operating room, it's the hardest day, because usually everybody likes to keep things even keel. It's, it's just your job. You go in and you do your job and then you go home. But the ones that you really remember are the toughest. So I have seen patients die in the operating room. I've seen really tough surgical cases where it's kind of, you go into panic mode, but you're trained to do your job. And so I think that it's kind of like any kind of police force training too, where it's like, you just go into the zone of like, this is what we got to do, step A, B, C, and D, and you just get through it. But yeah, it is very rewarding to be working in the operating room and working with other people in healthcare, but it is interesting being on the other side and actually being a patient. Mm-hmm. It creates a whole new way of looking at healthcare, because I was quite frankly appalled at going through the healthcare system. This is how it is to be a patient. How awful. Right. And I think that that's really changed the way I view going into work on a daily basis. So really it creates a different kind of empathy that really, I think most healthcare needs that point of view, to actually be a patient, to be the one going through surgery, to be the one going through treatment, and to see how you talk to people, because patients remember everything. I mean, right. Just the way when you're sitting there and you're so terrified, that feeling from the doctor, that feeling from the surgeon, you'll remember that. Even if you don't remember everything that they said, you'll remember the feeling that they gave you. And I take that with me to work now. So I'm glad that and I hope to share that with other healthcare people.
And do you watch any kind of medical TV shows or anything like that?
I don't, because I do and I don't, because every time I watch them, it's like, oh, that's not true. Right. Like watching House, we always called it the trifecta of like, oh, that patient has a seizure and then they have to be intubated and then they, go into cardiac arrest. It's like, that never happens. So it's hard to watch those because it's like, not true. But it makes for great drama.
There's a show filmed here in Atlanta called The Resident, and it comes on Monday nights. And so just watching it last night, and they did like a triple transplant where they transplanted someone 2 lungs, a pancreas, and a liver all at one time.
Yeah, that would probably never happen.
It's a lot. But yeah.
Yes. Because you'd have to have all those matching donors. It wouldn't happen. Yeah,
it's crazy. Somebody fell out the last minute, and then they had to just happen to get some more lungs from someone else, and it was TV drama for you. So
exactly.
All right. Well, let's dig into your story a little bit. So I like to ask all the guests why they feel like it's important to be able to share their story. And I know you have a very specific reason regarding melanoma in general. So why don't you tell our listeners why you feel like it's important for you to be able to share your journey and share your experience?
Yeah, I think that melanoma is very little known in terms of the cancer community, because people oftentimes just think of it, oh, it's another skin cancer, but it's so much more than just skin cancer. It's incredibly deadly, really. One person dies every hour from melanoma. It's the leading cause of cancer death for women ages 25 to 30. It's also the second leading cause of cancer in women aged 30 to 35. So when I was diagnosed, I was 31. I was right in that deadly stage. And the more you learn about melanoma, the more it's like, wow, this is not just a skin cancer. And so, just to let people know about melanoma, to get the word out that it is something serious and to be thinking about. And also to, really kind of inspire people to help them through their hardest times, because I think we all hit a wall at one point in time going through cancer treatment, whether it's through treatment, whether it's handling the mental battle of it all. It's hard, it's difficult, and nobody can prepare you for that. And nobody can really help you through that besides other people around you who have been through that. And so, just listening to this podcast, reaching out and getting help, there is help out there. You just have to find it and really advocate for yourself. And I think that, if I can help one other person by pointing out what melanoma is about, what it is, if I can help one person get through their toughest time with cancer, then it's worth it to, share my story and to actually help other people. I'm in healthcare, I'm a helper. And so it's, going through that, if I can reach back and help one person through their toughest time, then sharing my story and, reaching out to others is completely worth it.
I think when you get cancer at a younger age, like we both had cancer at the same age, you don't really think it can happen to you. So you automatically go into, you've been to school, you've had a great job, you've done all these things that you've prepared yourself for. Then all of a sudden you get cancer, which you haven't prepared yourself for, because you typically don't get cancer when you're in your early 30s. So I think that what you're doing now is you're almost preparing other people just in case they were to happen to have the same thing that you have. And I think that's amazing that you're giving back like that, because that's not something that everybody has, I would say, the passion or energy to do. And, we all need people like you to be able to tell your story and to really shine a light on this disease. I didn't realize it was, so prevalent and so deadly. So thanks for sharing those facts as well. So let's talk about your life prior to cancer. You had a lot going on in life. I know you're career-wise, and we talked about being married and all those things like that before. So why don't you kind of back us up a little bit and tell us a little bit about the pre-cancer Lauren?
Yeah. So, and I do consider myself a pre-cancer Lauren and then a post-cancer Lauren. So pre-cancer Lauren was busy. I was the picture perfect person of health. I was 31. I was striving so hard in my career. And that's what I think was expected of me. I think that that's what I grew up with my family. You really focus on your career. You really push hard. You try to do all that you can do. And in hindsight, I was pushing myself to an early grave anyway. I think I was really too stressed out. I was working too many hours. I was really being too selfless, if there's a way to classify that. So I was working 12-hour days was kind of common, taking lots of call at 2 a.m. about patients, things like that. And I was ignoring my own health. And it's so easy to do when you're young, because what's the saying? When you're young, you use your health to create your wealth. And then when you're older, you use your wealth to regain your health. I was on that track. And it was, looking back, the stress and the lifestyle. I was not eating well. I wasn't sleeping well, really pushing myself too far to get ahead in life. But if you don't have your health, you have nothing. And so it really, made me rethink everything when I was diagnosed. And, my goals in life are really to strive hard. And I think I still have those same goals, but I've changed my mindset now on how work can relate to our everyday life. Work is not a separate thing for me now. It's how I create it. It's, I think, taking kind of more of an entrepreneurial spirit. It's incorporated into my life now. And I can pick and choose, my health versus my career as a balance. It doesn't have to be one or the other. It can be both. And I think that being young and being diagnosed, it really is a shocker. Your whole life is put on the line because you're thinking so far ahead into your future. Yes. And death is never on the mindset. Your health is never on the mindset because you are young. And so I think, if there's one thing that really cancer brought me back to was thinking about health and thinking about wellness and what does that mean, and mental health and mental wellness. So, I think that was my pre-cancer Lauren.
Yeah, it's, I share a lot of the same qualities I think that you have, and it's really easy to be young and live in the future because we're working so hard for all the things that we want. So we're looking ahead and we're going through every day looking ahead, and we're not actually taking time to enjoy the process as well.
Absolutely.
And that's something that, cancer's kind of reevaluated for me. And it's really hard to get out of the habit of enjoying the process, and just being in love with the process is kind of like the next step. And that's something that, I guess we could probably say we've learned the hard way going through our journey, is to really love the process, love every day of the relationships that you have, the people that you meet, the cases that maybe you were involved in. That taking time to do that, cancer has a great way of readjusting your priorities in a way. So the day you were diagnosed, walk us through maybe some of the side effects or some of the symptoms that you were having at the time that led you to take that first trip to the doctor, and then tell us about the day you were diagnosed with cancer.
Yeah, it's I can actually laugh about this now, because the day I was diagnosed, it was just, the irony was all too much. So I had discovered my melanoma. I didn't realize that it was melanoma, but it was on my leg, on my thigh area. And one day I was just shaving my legs and shaved the top of it right off, which is really difficult to do. It had to have been pretty raised in order to do that. Mm-hmm. And I was just ignoring it. I was not noticing it. And it never healed well after I shaved the top of it off. And so I had just accepted a job in Florida. So I had moved cross country to take this job, and stopped at the dermatologist literally as I was moving into my apartment, had it taken off, looked at, didn't think it was anything, just thought it was, a mole, just a regular old mole that had gotten larger. Mm-hmm. And I was sitting in the occupational health office of my new job. So occupational health is ultimately like the general practitioner for any hospital. So if you feel like you need a sick day or you're not feeling well and you're on the job at the hospital, you go to occupational health. And I was sitting there for my pre-employment physical, and I get the call from the dermatologist's office that it was melanoma. Wow. And the PA is telling me about, okay, we need to do sentinel lymph node biopsy. We have to do an excision. We're going to take you to the oncologist, telling me all these things. And I'm sitting there in the occupational health office, looking fit as a fiddle, 31 years old, just starting a new job. And I'm about to get a physical to do this new job. And it was just, the irony was too much. I got off the phone with the PA, and I just sat there and I stared, and I'm like, what do I do?
Right.
I was just diagnosed with cancer, but I'm going into a physical to start a new job that I just moved cross country for. Wow. And so I go into the physical, and it's like I'm two people. Looking back on it, I felt like two people at the same time. I'm the person on the inside freaking out, and I want to shake the nurse and scream and yell and be like, I have cancer! Can't you tell I have cancer? And I'm still looking completely normal. And it was, the irony of it was just so much that I can look back on it now and laugh and realize it's almost like an out of body experience. But the PA definitely expressed to me how serious it was. I knew right away that it was serious, the way she was explaining things. And moving cross country for a job, it's already overwhelming, starting a new job, starting over in a whole new state. And now it's cancer treatment time. Then all of a sudden you're thinking about surgeries, and you're thinking about, what does this mean? The diagnosis. You're meeting with oncologists at a whole new hospital with a whole new team. You don't know anybody. Mm. And it was just terrifying. And it actually led me to move back to New Hampshire, which is part of the treatment journey. But it was just too much. It can be overwhelming just in general when you're told that you have cancer, but being in a different state, a different job, it really was incredibly overwhelming for me at that point in time.
It had to be like a shock to your system that, not that it would have been any easier back where you knew everyone, but still, like, now you have a completely different team of people to be around that are going to take care of you. How did you begin to process all that at once? First of all, did you finish your physical there and go do something else? What happened?
I did, because again, I was still so stuck on the career mindset. It was yes, I'm going to get through this physical. I'm going to start my job. This isn't going to delay me. I'm going to get through it. It's just, still so career focused. And I think that again, that was part of my journey, and easy to look hindsight to be like, oh, well, what was I thinking? But it's, you're just so focused on what you're used to focusing on. It's hard to pull back along the journey and be like, okay, this is a whole new road. We have to adjust the thinking here. And so at that point in time, I was still so focused. And it took a little bit of time. I still was working there for about 4 months before I finally was just like, this is not for me. I can't focus. Mm-hmm. I can't be here. This is not my treatment team. I need to be elsewhere.
So you left and went back to where you were originally. Is that right?
Yes. So that was part of the treatment journey. So in terms of treatment, then I wasn't liking the options that they were giving me either at that treatment facility. So moved to New Hampshire again, where we still had a house, and kind of started my treatment journey. I felt like I just needed to cut my career. I knew that if I could focus on my health the way that I was focusing on my career, then I had a fighting chance, because it took a mental shift of, I can't just focus on my career anymore. This has to be a focus on health. And so I literally just picked up that focus and moved it over to the health category. And I went all in on natural. I was changing my diet. I changed my mindset. I learned to meditate. I learned to journal and how to write through my emotions, and found a different oncologist and a different oncology team. And at that point in time, in 2015, for stage 3B melanoma, there was no treatment besides watch and wait. It was surgery to take out the lymph nodes. But then after that, there was literally no good option in terms of treatment. Chemo did not work for melanoma. It still does not work for melanoma. And immunotherapy was just in trial stages. So unless you wanted to be a part of a trial, there was no treatment option. It was just watch and wait, which is terrifying.
Yeah.
You're diagnosed stage 3 cancer, and it's just like, yeah, we'll just hang out and watch you. So I really dug into the all natural treatment, and I really put my focus there. And I even though I did progress to stage 3C through in transits that were in my leg. So other melanomas popped up in my leg where my original was, but they were underneath the skin. So they show up as lumps underneath your skin. I did progress to stage 3C and was able to go into treatment options. But, I'm glad that I did do the natural treatments, because it did help me to gain control of my mindset. I think it really did help me just completely hit the reset button on what is important in life. I really got to pull away from career and focus on health, and really think about, what was important to me, how I can change my mindset to help me, really believe in your medicine. I think that that's the first thing in treatment options. No matter what you choose, believe in your treatment, because that will help you through. Even if it doesn't work, it will give you some kind of mindset change, that it will teach you something. If you just take every day as a school day, if you learn from it, then it will help you further along in treatment. It will help you through your journey. And then once the in-transits were popping up, my new oncology team helped me to decide on another treatment option, which had just been approved. So what they did was they left the in-transits in my leg, which was a scary option, to see those golf ball-sized lumps in my leg. But they left it in my leg and considered me unresected stage 3C. So then I could go on to stage 4 treatment, which was immunotherapy. So it was, changing teams, changing surgeons, changing oncology teams, changing mindset. I think that really helped me to get with the right team and get with people who I trusted. Because if you don't trust your team, then you can't trust your treatment. And if you don't trust your treatment, then you can't trust your future. So I really think that you have to believe in your medicine. You have to believe in your team. If you don't trust them, if you don't like what they're telling you, if you don't even like the way that they're talking to you, trust is so important, and you have to find a team that you trust. So, and you have to find a treatment that you trust. So get a second opinion. I encourage people all the time. If you are not comfortable, then keep looking, because it's so important to have that kind of trust with your team. And it's so important to trust your medicine, because that really does make a difference.
So as you're going through all these, physical symptoms, they're letting the tumors stay there basically in order to treat you in another way. Let's talk about your mental health as you go through this, because that's something that not a lot of people talk about. When it comes down to treatment, most of the times, we're really aggressive to treat all the physical side effects, right? And the symptoms and stuff that we see. And the mental health side gets completely ignored. Mm-hmm. How was your mental health as you were going through all of this? Like, what was it doing to you? Maybe from like an anxiety, depression kind of stage, and where were you at, and how were you dealing with all that?
Yeah, I think my lowest point was while I was going through treatment, the immunotherapy treatment. So they put me on a combination immunotherapy treatment, and the side effects were really tough. Immunotherapy revs up your immune system so that it can start to attack the cancer, but it also attacks your own body. It takes away the inhibitory response, where your immune system senses self versus non-self. So instead of attacking just non-self, it attacks self as well. And so the treatment was really, it did get tough. And I had a difficult time processing that emotionally, because it really does bring you down. When you're physically down and not capable of doing anything, and you're nauseous all the time, and you're on the toilet all the time, and you really don't feel well. To me, that was when I hit my lowest emotional point. And what really got me through that was relying on the things that I had learned when I had gone natural: meditation, journaling, reading inspirational books and things, really realizing that I had to lead myself through this period in time. I was great at leading others and helping others, but I'd never seen myself as somebody to help. Mm-hmm. And so I think mentally going back to the things that had really helped me gain a different mindset were huge. And I think journaling for me was really big. It helped me process emotions that, you don't want to think about. Things that when you are at your lowest point, that's physically and then emotionally at the same time, that's when your mind wanders. Right. That's when it wanders into what happens if I die. What is death? What is life? What is the meaning of life? Am I worth being a survivor? Do I deserve that? Mm-hmm. And so I think that, mentally, as you're processing that stuff at your lowest point, that's when you need to be your own leader and lift yourself up, because it is difficult. And other people around you don't know where your brain is at. They can see where you're at physically, right? But we don't talk about these things. When you're at your lowest point, you don't want to talk about it. When people are depressed, they don't want to talk about it. I think that's why people who do end up committing suicide, oftentimes they don't tell family and friends, because it's all in their head in terms of where they're at emotionally, but they're not letting people know physically.
So let's talk about journaling a little bit, because I know that's something that's really, you said it was really important to you. What are the benefits of journaling in your mind?
Oh gosh, journaling really helped me process so many things, because to me, journaling is talking and listening at the same time. It's talking as you're writing, you're physically talking to yourself through words. And then later on, you can go back and read that and process it as a listening exercise. So it's really having a true conversation with yourself. And it creates in your mind just a way of processing things and truly understanding who you are, what you are here to do, your purpose in life, what you really want to do with your life, what your goals are, where your feelings are coming from, why you feel the way you do. It really helps you dig into those emotions and process them, where I know a lot of people can potentially go to therapy and talk it out, but I didn't want to do that. I had that stigma of, that means that I have a problem, and I didn't want to admit that I had a problem. So I processed that through journaling. And it's such a stigma of mental health that it's mental health. Everybody needs mental health. It's not just a you or a me or people who are depressed. Everybody going through cancer treatment has a time guaranteed where they are going to hit a time where they're just not mentally 100%. Mm-hmm. It's just a guarantee. And so I really do hope that other people reach out when they do have that time period. There are ways of helping others out. There are groups out there. Don't be afraid to talk to a therapist. If you are afraid to talk to a therapist, try journaling, try talking to people. It's difficult to get out of your head, but there are ways of doing it that will help you. And there is help out there. It's just that you have to express to others that you might need that help. And journaling, it really did help me. And so I created something called a journey journal for cancer patients or people going through cancer. I hate that word patient. So it's for people going through cancer. And it's something that I created based on what I could have used during those periods of time. So it has prompts that are quotes from people about different emotions, health, happiness, what death is, what is the meaning of life. And it really helps you process those things. And it also has a section for goals where you can create goals, because I feel like if you have a goal, that's really the connection piece between present life and what you want your future to be. Is setting a goal helps you kind of jump that. And so if you set goals, I feel like setting goals for myself was a huge prompt for me to help to strive for the future. Mm-hmm. And if you don't have that kind of future thinking without the anxiety, so I know a lot of people think about future and they get anxious, but if you don't have that future thinking where it's positive, then what is there for you? It creates a downward spiral of, what is worth living for. And you have to have those future goals and future mindsets of like, things can be good, things will work out. Mm-hmm. If you don't have that, then it's really difficult to get through the day to day.
I think as human beings, it's almost human nature to pick the path of least friction. And lots of times not addressing an issue is the path of least friction. So we tend to ignore whether it's a physical side effect that, I know men get a bad rap of not wanting to go to the doctor and stuff, but emotionally, I think too, it's one of those things where if we just keep putting it off, eventually it'll go away, but you're just building up something massive, and that tidal wave of emotions and everything will crash onto you eventually. And I like what you said about the journaling, how it really started picking apart what was in that emotional closet of, stuff that had built up. And, I know your journey journal that you have really helps people address that issue a little bit at a time and really tackle one little thing, because it can be overwhelming, especially, the more you let the laundry pile up, the least you want to fold it, kind of thing. So
exactly.
So, having a journal, it's one day at a time. It's going through something a little bit at a time and processing that as you continue to go out. And before you know it, like everything's kind of caught up in a way, and you're allowed to really start planning for the future more when you're setting your goals. And I know you went through all of that as well. And what I like about what you've done is you saw a problem whenever you were going through your treatment. Again, you said there wasn't a tremendous amount of resources, and there wasn't a way for you to really process, and no one was there to teach you, I would say, how to process everything. So you've created something on your own now, and you're really, I guess, promoting that to have people, give people an option of not face something that you had to face, which I think is absolutely amazing. So let's talk more about your journal for a second. So if someone, wants to take a look at your journal, where's the best place they can go to find out about your journal and maybe get an idea of what it has in store?
Yeah. So I completely agree in terms of, processing emotions. You can't bottle it up. I mean, I did come from a family where we didn't discuss emotions. We didn't discuss what you were feeling. Feelings were just a thing that you had that you dealt with on your own. And that was never a topic of conversation over dinner. It was always, strive harder. This is what you're doing today. I played softball. It was always, practice, put your best foot forward, and don't show anybody if you're disappointed or hurting, or, if you failed, you keep it inside. And I think a lot of people do have that difficulty processing these emotions with cancer, because every day is very different. You wake up some days and you feel like, hey, I feel good. I don't even feel like I have cancer. Other days you wake up and you feel like, oh my gosh, like I don't know why I feel this way today, but I'm really down. I can't do anything right. My life is in ruins. My finances are in ruins. And so I think that I hope that journaling will help other people process their emotions the way that it helped me. And I do hope that the Journey Journal will help kind of guide people through the process, because journaling isn't exactly natural to people. It's, you might sit there with a blank page and be like, what do I do with this? I don't want to just write. And so having some prompts, having some different segments, like I said, it's broken down into different segments that help you process the path through the journey. So, you kind of go through the healthy stage, where there are quotes about health and happiness and what that means. And then there are quotes about death and depression, and it helps you process those. So it gives you prompts to help you kind of go down that path. And when you flip to a page and a quote really tickles you or really touches you in a place, then write about it. And it helps you think about those emotions and process it. And I do have a small group that I'm working with on Facebook through a melanoma group to kind of create a journal club, so that people who aren't used to journaling can go through the journal with me, and we can go through it together in the sense of journaling together, so that they can get the most out of the Journey Journal. And I'm not quite sure if that's the path to go down with the Journey Journal, to create more journal clubs, or if people just want to buy it individually. That's on my website, which is withinmyskin.com. And they can purchase the journal directly through there. And like I said, other groups doing a journal club, that would be great too. I'm very open to that. Please let me know if you all, like that idea, because I know that some people, like I said, really gravitate towards journaling. Other people want to do it, but they're not quite sure how to start. So I think the prompts of having a journaling club is very helpful for some people. And it creates a little bit of a community around journaling. It's easier to talk about things that you journaled about rather than your emotions, because it's like, oh, well, I wrote this rather than I was feeling this. It's a little bit of a separation. So I think that some people, it helps them to discuss it on a separate level. So journaling clubs are an option in the future.
I had never heard of a journaling club until I spoke with you the first time, which I think is a great idea. I always feel like people either need to be taught or reminded. The journaling club really teaches people how to take that first step in a way, and obviously stay motivated to continue to journal, because once you stop, things start piling up again. And all the great leaders that you hear from, even a lot of the great entrepreneurs that I follow, journaling is one of their daily habits. So it's definitely a habit of successful people. And people may not be chasing some kind of crazy entrepreneurial journey, but when you're really fighting for your health, being able to use a journal like yours really helps lead them through the process. So, I appreciate you doing that. I'll for everyone listening, I'm going to drop a link to Within My Skin on the show notes page. They can check that out and go to your website and purchase a copy of your journal. So if we take a look at your own personal journal that you've written in over time, I know you talked about the lowest moment when you were going through like the immunotherapy and things like that. How did you overcome that moment and really get on the other side? Because I feel like during everyone's diagnosis and everyone's treatment schedule and stuff, you hit rock bottom at a certain point, and it's always a different place for each person, maybe physically, maybe mentally, spiritually, emotionally. It's one of those areas where probably we were the weakest in to begin with, and we hit rock bottom there first. How were you able to, dig yourself out of that hole and really get on the other side of, the depression, the anxiety, all those things that you were feeling?
Yeah. I think that physically, it really did hit my lowest point physically and mentally at the same time. Because physically it was immunotherapy really bringing me down. I mean, I had gastritis, I had colitis. I was really just not able to get out of the bathroom very, very far. Yeah. And it was, I feel like cancer is kind of like a hurricane where it comes through all of a sudden and it will just strip you down to bare bones, and it will bring you down to really a low point. And from there, you have to build up again. You have to rebuild that structure of your house. And so physically, I was at my lowest point. But then looking at myself physically, I had lost 20 pounds, and I don't have 20 pounds to lose. And I was really not feeling well. My hair was starting to thin from the immunotherapy, because it doesn't make you lose your hair, but it does make you shed. Mm-hmm. And I was having rashes and things like that. So you're just physically miserable. And then on top of that, you're, looking at your life and it's like, is this worth it? Why me? Why do I have to go through this? All the what ifs of the future. What if this doesn't work? What if I'm stuck with side effects long term? It really does mentally kind of bring you into the vortex of the hurricane. And, it's one step at a time, rebuilding. That's what it is. It's one day at a time. It's one step at a time. It's just talking about, how you're feeling. It's getting your emotions out there. It's difficult. It's not easy for me to sit here and talk about emotions and things like that. But, I've actually learned from the journey that every day is a school day. Mm-hmm. Every day is a day to learn. And if you can pull away from the mindset of like wallowing in your misery, which is very easy to do. We all want to do that. If you can pull yourself out of that and say, what can I do right now to feel better? What can I do right now to help myself? And I think, as I said before, I kind of had to learn to lead myself mm-hmm. through that process. So, if I really was having a tough day mentally, I would sit down. I remember one day in particular, I sat down to meditate, and literally I just couldn't stop crying. I was just sitting there crying for like 20 minutes, and it's just to let it go. Mm-hmm. And I think you have to learn to let it go. And if you need that 20 minutes to just sit there and cry, then let it out. Don't hold it in, because that will bring you down further. So I think learning to lead myself through that emotion was difficult. But if you do so one step at a time, one day at a time, working towards those goals, those future goals, if you can keep those in your mind, it really does help you to get through those periods of time, because it's, you can have something to strive for, have something to wake up in the morning for, even though you feel terrible, even though you really don't feel like getting up and out of bed, even if you're getting up and out of bed and just moving to the couch. At least you did something with your day, and at least you're trying to move forward.
Right.
I think that's the number one thing that really got me through, is just taking it day by day, learning every day how to process those emotions, how to pull myself out of that muck, and not wallow in it, just to be like, okay, today we're going to, think about how it is that we're feeling and process it and move on. And I think that, it's easy physically sometimes to just power through it. It's like, oh, it's just a side effect. Here's another medication to help with that side effect. And then you move on. And so everybody who you go to in terms of your doctors will help you with the physical side effects, but you have to help you with the mental side effects. And so I think that just learning that and learning how you process things and helping yourself through that is how I did it.
Yeah. I think it's important for people to know it's okay to feel terrible and to think those crazy thoughts, and to really, not be ashamed of some of the things you may think, but it's not okay to stay in those thoughts.
Exactly. I think that every day everybody has those emotions when you're at your lowest point. Everybody. You are not alone in that feeling. But to stay there, that is not a good thing. So work towards whatever it is that you have to do to get out of there. Work towards it. It's worth it. Work towards it.
Yeah. You just said it's worth it. You're worth it. I think that's something that we need to remind ourselves of sometimes, that, it is really easy to get caught up in the why me and to cry yourself asleep and to, look at all the statistics of what could possibly be and all these things. But at the end of the day, like, your life is worth it. And I think if you can hold on to that gives you some hope for the future. You may not know what the future holds, but knowing that you're worth being here and you're worth being a part of it, you can deal with the rest of it. So I think I'm grateful that the conversation kind of led to that. You have a lot of experience, obviously, in the medical field, and now you have a personal experience going through your cancer journey. What type of advice would you have to give maybe a young adult who's experiencing melanoma, or just people in general when it comes down to maybe some facts or some things to look for when they're diagnosed with melanoma?
Yeah. So in terms of melanoma, there's a few things that people can look for in terms of, I guess melanoma is an interesting cancer in the fact that you can see it at the beginning stages. So I did not feel sick, but melanoma is invasive and it starts at your skin level. So you can do your own skin checks. If you're concerned with something, go see a dermatologist. If you have a line in your nail, a black line in your nail, melanoma can be underneath your skin nails. It can be mucosal. It can, right? Bob Marley actually died from melanoma, and it was underneath his nail. There's mucosal melanoma, so if there's a spot inside your mouth. There's ocular melanoma, so you can actually have melanoma inside of your eye. If you have a mole that is concerning, they have the ABCDEs of melanoma. So a dermatologist will check for A, stands for asymmetry. So if it's round and symmetric, then that's okay. If it's asymmetric, then you might want to get it checked out. B is for border. So if it's an irregular border around the mole, then you should have it checked out. C is for color. So if the color is varied from one area to another, or if it's really dark and doesn't look like the rest of your moles, have it checked out. Diameter stands, or D is for diameter, where usually melanoma is greater than 6 millimeters, but that's not always a guarantee. So 6 millimeters is about the size of a pencil eraser. So if it's larger than that, have it checked out. And E is for evolving, which means that the melanoma is changing. So, or the mole is changing. So that's how mine was really discovered. It was large, but it was also evolving. So it was raising in terms of the height of it. So if you have any moles that look different now than how they used to look, have it checked out. So for sure, all these things are things to have checked out by a dermatologist if you're concerned. And if you are concerned, don't be afraid to go to a dermatologist. Moles do look different on everybody. Every time I go to the dermatologist, they're like, you have a smorgasbord of moles.
Right.
And, I cannot diagnose moles. Only a dermatologist can diagnose it. So they'll take a biopsy of it and send it off to have it checked. So even if it looks normal, there is a small chance that something could be wrong with it based on other things. So if it is normal looking, but it's been changing, get it checked out.
So are you the mole expert in the family now?
I wish. That's the funny thing is I am glad that in the sense now that I've had melanoma, a lot of my friends and family have come forward and been like, oh, I went to the dermatologist because of what happened to you, and I was diagnosed with basal cell carcinoma, or I had one that was precancerous, and they did remove it. And so I think just awareness is huge because we take our skin for granted. It's the largest organ of the body, but Often do you think of your skin? You don't. Another thing is avoid tanning beds. I know that I went before my wedding. I think that's very common for young women to go to tanning beds before a wedding to make sure that you look good. But if you go to a tanning bed before the age of 30, it increases your risk of melanoma by 75%.
Wow. So
it's just these things that you don't think about that can potentially really be dangerous. But be vigilant with your skin checks. If you have a family history of melanoma, go to the dermatologist.
Tons of great information. Yeah, but definitely, I think I encourage everyone to go back and, rewind this episode a little bit and really jot down those facts, the ABCDs of what you just mentioned. That's great knowledge to have. If our listeners want to connect with you, what's the best way? I know they can go to your website, withinmyskin.com. Mm-hmm. What's the best way for them to connect with you? Are you on social media or?
I am. You can follow me on Instagram. I try to be somewhat inspirational on Instagram. So that's at L Feltz. So my last name. I'm on Facebook at Within My Skin. That's skin with 2 N's on Facebook. And you can always email me at lauren@withinmyskin.com. And please, by all means, reach out to me. I love to hear from people. If you have any questions about the journal, or if you would like to join a journal club, then reach out as well.
Perfect. Lauren, I appreciate you being a guest on the show. I've learned a ton myself. Again, you're the first person I've had on that's had melanoma. So thank you for providing all the facts and really being vulnerable enough to share your story. I think this is, you're only in the beginning of what you're going to accomplish from all this. And I'm always a firm believer that the things that happen to us in life don't just happen to us, they happen to everyone around us. And the way we handle each thing really propels us to being able to help so many other people in the future. And I know you're already doing that through your journal clubs, and now I'll be on the podcast sharing all this information with everyone. Just the impact that you're going to have. You mentioned earlier in the show about, one reason why you like to tell your story is if you can just help one person. And I think you're going to help, a multitude of people by all of your diligent work and, again, your vulnerability as well. That's, again, I know it's not, a comfortable thing you mentioned, for you naturally, but right. That's where all the growth happens is when you're uncomfortable. And, you doing shows like this, you putting yourself out there, I think you're just going to provide a tremendous amount of knowledge and inspiration for people and really be able to teach them what to look for, how to process all their emotions and all those things. So I'm really excited for your future. I'm excited for all the things to come. And I'll make sure that we stay in contact with you. And again, I'll post some links to your journal so people can check that out at withinmyskin.com. But thank you again for being a guest on the show today. And I'm really looking forward to all the great things that you're going to do.
Well, thank you so much, Truett. Thank you for doing your podcast. I think it's also inspirational to people to feel like there is a community out there for them with being a young adult with cancer. I think that's huge. Finding your community is, I think, a great way to start, having that support system that everybody needs going through cancer.
Awesome. Thank you very much.
Thank you.
We appreciate you spending time with us on today's episode and encourage you to continue the conversation to help you keep pushing forward. For more resources based on today's episode, as well as ways to recommend a guest and connect to Truett personally, head over to 1%podcast.com. Be sure to join us next time for more stories of inspiration right here